Good evening, everyone. I'm Dr. Cindy Russell, co-chair of the Santa Clara County Medical Association's Environmental Health Committee, and we welcome you to tonight's presentation with Dr. Tracy Woodruff and Dr. Nick Chartres, who will discuss corporate determinants of health and the UCSF Internal Industry Document Library with a video by Kate Tasker, who is the director of the UCSF Industry Documents Library. Thank you for joining us. This webinar is the last in our four-part Environment and Health webinar series 2026, where we've discussed with experts microplastics, obesogens, and the realities of nuclear weapons. Tonight's webinar addresses all of these topics within the framework of industry influence. This program will be recorded and posted on the SCCMA website on the Environmental Health webpage for viewing later, along with prior webinars. A little bit about the Santa Clara County Medical Association. The SCCMA is a professional organization representing more than 4,700 physicians across all specialties, practice settings, and stages of their careers. Their mission is to support physicians in delivering the highest quality care to their patients. The SCCMA works through advocacy, education, and community engagement with local, state, and national partners to promote the practice of medicine, advance public health, and protect the well-being of both physicians and patients. Today's webinar is part of the SCCMA's ongoing commitment to provide timely, relevant, and practical information to the medical community. These sessions are provided to foster collaboration and knowledge sharing across healthcare ecosystems. It's a wonderful organization, and I'm proud to be a member. So before we get started, a few things to mention. You'll be muted during the entire program, but we invite you to post questions anytime in the Q&A box. We will not have live audio questions. We will take questions for our speakers at the end of the program from the Q&A box. Also, we have many resources for you, and we'll try to post these during the program in the chat box, but if not, we will make every effort to have these available on the website linked to the recorded video, which will be on YouTube at the SCCMA channel. So tonight, Dr. Woodruff and Dr. Chartres will discuss the Center to End Corporate Harm and the Digital Archive of the UCSF Internal Industry Files. I'm very honored to introduce these brilliant and dedicated researchers working to protect both humans and nature. So I'm going to introduce both at the same time. Dr. Tracy Woodruff, she's an international expert on chemical and regulatory policy. Her work has shaped both national and global policy on climate and environmental toxicants. She's a professor of epidemiology and population health and a senior fellow at the Stanford Woods Institute for the Environment at Stanford. She is also director of the Center to End Corporate Harm, which we will discuss tonight. It's a multi-institutional center that includes UCSF, Stanford, and the University of Australia as affiliates. Dr. Woodruff is former director of the UCSF Program on Reproductive Health and the Environment, a leading research public policy center devoted to creating a healthier environment for human reproduction and development. She did a lot of work there. She's previously served as a senior scientist and policy advisor for U.S. EPA's Office of Policy for 10 years. She authored the first international study to link air pollution and preterm birth, and was the first to document multiple toxic chemicals in pregnant women and newborns across the United States. Her current work focuses on uncovering and addressing environmental determinants of disease and health inequities, especially with regards to children. Her research covers how harmful chemicals and pollutants impact health, reproduction, pregnancy, and child development using exposure assessment, environmental epidemiology, and risk assessment of environmental chemicals. It's critical research that requires careful, complex analysis. Thank you for doing that. And has transformed how we understand the impact of chemical exposures and pollutants on pregnancy, development, and lifelong disease. In her 25-year career, she's published more than 220 peer-reviewed scientific articles, including publishing novel findings on multiple chemical exposures in pregnant women across the U.S. and pioneering methods for measuring and interpreting prenatal chemical exposures, in addition to an article on how the U.S. Toxic Substances Control Act has failed to protect us. She leads efforts to translate scientific information into actionable change directly for patients through public policy. And Dr. Woodruff was just elected to the National Academy of Medicine in 2025. Dr. Nicholas Chartres, he's an associate professor at the University of Sydney and a member of the Center to End Corporate Harm at the University of California, San Francisco, where he studies tactics industries use to undermine science and regulations to protect their health-harming products, focusing on chemicals and ultra-processed foods. He's also a research methodologist and works with national and international organizations and agencies, including the World Health Organization, to conduct reviews of scientific evidence and develop guidelines using empirically based methods to ensure improved consistency, greater transparency, and reduce bias when evaluating scientific evidence and formulating recommendations. He's also worked on microplastics. We welcome both of you tonight to speak. And first, thank you so much, Dr. Woodruff. We'll have you speak first. Thank you.
All right, thank you. And it's nice to see you again, Cindy, albeit online. We're actually in the same county now, so there you go.
Yeah, it's great.
All right, so tonight I'm going to talk about our Center to End Corporate Harm, Defending Science, Protecting Health, and the information about what is driving the importance of doing work to identify and address corporate vectors and corporate health harming products. And I have no conflicts to disclose. All right, so we know that we are exposed to many different types of pollutants. As Cindy mentioned, you've heard about microplastics and plastic-related materials, air pollution, other types of toxic materials. But these are not by accident. They are actually designed by corporations who market and sell these products to which we are exposed. And we know that environmental health is a very important component of health, both in the United States and globally, meaning the exposures that we have from toxic chemicals and pollution that can adversely impact our health. So this is a report from the World Health Organization that said that almost 14 million deaths in 2016, which is about 24% of global deaths, are due to modifiable environmental risks. So essentially, that's 1 in 4 total global deaths are linked to environmental conditions. And these environmental conditions are a result of activities that happen at the corporate sector. So one of the things that, as Cindy mentioned, I used to work at EPA, and I worked on particulate matter air pollution and acrolein, perchlorate, zinc. These chemicals were chemicals that I had the responsibility for engaging in some way, whether it's through assessments of their risks or policy-related activities that EPA was undertaking related to these chemicals. But one of the things that was very clear when I was at EPA, and that is happened before and was ongoing, is that there are a number of different corporate actors, whether they act through consortiums like the American Petroleum Institute or the American Chemistry Council, or individual corporations, which make these different or produce these different products, or are actively working to tell EPA what they think about the science and the health risks from these different types of products. And in board, they are essentially working to have EPA reflect their viewpoint that underplays and downplays both the risks and the policy and regulatory activities that happen because of that. And so essentially what was happening was that it was a different chemical on maybe a different day or a different week or a different month, but we would be facing the same types of arguments over and over again related to these chemicals. So you may be familiar with some of them in your work. One would be if you had data in animals, robust data in animals, these industry groups would say, well, animal data do not predict human data. And then if you had robust data in humans, they would say, well, human data do not predict animal data. So a good example of this is formaldehyde. You see that formaldehyde can increase the risk of leukemia, but you don't see this necessarily in the animal data. So depending on which data set was being used to evaluate the health effects, the industry would argue that that wasn't relevant based on other species. Sometimes they would talk about modeling exposure being too uncertain, so you couldn't really know what the exposures are. And on the other hand, measured exposure data does not agree with model data. So basically poking holes in both mechanisms by which EPA obtains data, for example, in this case on exposures. And essentially, and this is something that a very senior official at EPA said when we were reviewing the delisting of a particular air toxic, was my gestalt of the data is that it is not toxic. And this is led to because a lot of people at EPA are constantly hearing from the chemical industry about why the data is so very uncertain for making decisions. But yet the American public is exposed to many, many different types of pollutants all at the same time. Many of them are not regulated sufficiently or not they are occurring at levels where we know that there are increased risks in the population. And we can see this reflected in the increase in chronic disease that has been occurring. We have this data here from the last 30 years, but even back to the 1980s, where a number of different diseases have increased dramatically in the population. So Parkinson's has gone up over 130%, Alzheimer's and other dementias, total cancers have increased, and in particular, we're seeing increases in cancers, particularly among young people, like colon cancer and breast cancer, and a dramatic increase in diabetes or metabolic disorders. And this change over this short period is not driven by genetics, but by these modifiable or preventable environmental risk factors. At the same time, we've seen a dramatic increase in the global fossil fuel consumption, which has been used in part, to make these different types of petrochemicals or chemicals that we're exposed to, as well as the increase in plastic production, which I know there was a talk on this last week. We've seen a dramatic increase in plastic production, particularly with the advent of fracking, where there's been a doubling in plastic production since 2008, and it's projected to continue to increase. And there is a projected increase not only in plastics, but petrochemical production that is anticipated to grow, maybe even triple by 2050. And so the rise in this chemical production is in part responsible for this increasing burden of chronic disease. And we also know from often from these internal industry documents that the industry is very both focused on developing these and then protecting their financial interests. This is also an example of where the oil companies are now transitioning to put more of their extraction of fossil fuels into plastics because they are seeing a transition away from using fossil fuel for heating and cars as people move to electric cars and other heating for homes. And the fossil fuel industry is moving into these different new markets. So what we've seen also, in addition to increase in chronic diseases, is that there's been a shift in the total burden of disease in terms of what's responsible for the total burden of mortality globally. So it used to be in 1990s that communicable diseases, things like Giardia or other types of diseases that are transmitted via water or vectors, was the highest share of disease at a global burden of death at 40, almost half of global deaths. But what's happened since 1990 to 2019 is that communicable diseases have gone down somewhat, but it's been overtaken by the increase in non-communicable diseases. These are things like cancer, respiratory, cardiovascular, neurological, and metabolic disease. So now that we are seeing that non-communicable diseases or chronic diseases are now the highest burden of mortality in the world at 64%. And so this again is being driven by exogenous causes that are being driven. And there are 5 commercial products that are responsible for about a third of deaths each year. So fossil fuels, tobacco, ultra-processed foods, chemicals, and alcohol. So essentially these health-harming products, which are being produced by corporations, are contributing to a rise in chronic disease. So if we want to address the burden of chronic disease and reverse these trends, we need to not only address the products that are contributing to us, but the corporations that are making these products and then which contribute to disease and death globally. So the missing puzzle piece here for myself, as well as the other members of the Center to End Corporate Harm, was how do we think about this new paradigm of chronic disease, increasing chronic disease that's occurring not only in the United States, but globally. And essentially, we have a new vector of disease. So previously, when we had communicable diseases, a disease vector was a living organism that carries and transmits an infectious pathogen to another living organism. So think of malaria. And these vectors they are blood-sucking. But today, we have now non-communicable diseases, and we have a disease vector, but instead of a living organism, we have a corporate organism that transmits toxic environmental exposures. Think of your ultra-processed food, which Nick will be talking about, which contains not only non-nutritive components, but also can carry many toxic chemicals at the same time. So what we're seeing is an increase in non-communicable or chronic disease is a manifestation of a global economic system that prioritizes wealth creation over health creation. This has also been identified by the World Health Organization that has labeled this the commercial determinants of health, which is defined as private sector activities that affect people's health negatively, directly or indirect, that affect people's health directly or indirectly, positively or negatively. And this happens through these various impact areas, including influencing the environments via supply chains, marketing, labor conditions, research funding, and lobbying. And the increase in risk factors include smoking, obesity, air pollution, non-communicable diseases, etc. And the burden of this activity falls disproportionately on young people and marginalized populations. So essentially what we have today is an industrial epidemic that's being produced by these different corporations that are making and marketing and selling and promoting health harming products, tobacco, chemicals, fossil fuels, alcohol, pharmaceuticals, unhealthy foods, ultra processed foods, and among some of the currently identified top risk factors. So again, about 50% of all premature deaths are due to these corporate produced risk factors. So there are a number of people at UCSF who work on understanding and addressing various corporate actions that lead to the production of these different health harming products. So there's a center related to identifying and addressing tobacco resulted health harms. There's people who work on ultra processed food, people who work on the pharmaceutical industry, and but we were working all in different areas. We work on the role of chemical corporations and fossil fuel. And we realized that in order for us to be more effective, we should share and identify the role of these corporations as a current vector of disease so that we can both study them and identify solutions based on previous research that's been done primarily in the tobacco field to address this new vector of disease to essentially reduce the exposures and improve health. So the Center to End Corporate Harm is a relatively new entity, which is a just, healthy, and democratic society where public health policies are built on unbiased science, free of industry influence. So we have a number of faculty across the UCSF campus that are members, as well as different partners and different schools at UCSF, and we also have collaborators at different universities, both in the United States and globally. We have a steering committee made up of a cross-disciplinary team of faculty members, myself and Nick in University of Australia, Pam, who runs the Center for Tobacco Control Research, and Laura Schmidt, who's an expert in food, and Chris Schaefer, who's the university librarian at UCSF. And one of the big products that we have started with is to essentially a consensus paper, which was published in the New England Journal of Medicine last month, that identifies corporations as a vector of chronic disease and strategies for using internal industry documents to craft counter strategies. And Kate will talk more about the industry documents library at UCSF, which really is the driver, the source of a lot of our empirical based research, and I'll just briefly talk on it here. But this paper also talks about solutions to addressing the corporate health harms, including requiring public transparency of corporate funding. These are all on the paper. Holding corporations to the same standards of data sharing and open science, ending financial links between industry and researchers, and that policymaking should be safeguarded from corporate influence using policies such as the Framework Convention on Tobacco. And each of these identified solutions has been implemented, albeit in either a particular sector. So public transparency has already been implemented via the pharmaceutical payment database in the United States, or in a particular country. So number two, which one? Financial links between industry and researchers has an example of some policies in Italy where they take corporate funds and then use that to fund research via an independent mechanism. So, okay, so we also identify, and this has been based on many years of research using internal industry documents, which I'll talk about in a minute, as well as studying primarily of the tobacco industry, but also of other industries that what are the mechanisms by which they disrupt the process that leads to promotion of their products and then increasing health risks. So there's three mechanisms of power: knowledge capture, which includes producing industry-funded science, suppressing unfavorable science, and funding key scientists to disseminate industry messages; policy capture, this includes lobbying, revolving doors, and setting scientific standards, and then shaping public discourse. So these are messaging campaigns, PR, and also front groups and think tank groups, which I think Nick will touch on. And this leads to promoting environments that are favorable to selling their health harming products and adversely impacting health. I'm gonna just check this. So I'm going to talk briefly about the industry documents library, which Kate will talk more about. Essentially, it's got 24 million documents. It was started with internal documents from the tobacco industry back in the 1990s. It's expanded to add multiple other collections, including chemical, opioids, drugs, food, and fossil fuel. But it's been the basis of over 1,000 publications. And this has created an empirical research database that using these documents, which are internal and show what the industry has done in their own words to hide, obfuscate, or mislead related to the science and public policy. These publications have been instrumental in identifying the role of the tobacco industry in promoting tobacco products. It's shaped U.S. regulations and has led to the global treaty related to tobacco control. So I'm going to end and turn it over to, I think it's Nick, right? Or is it the recording? One of these people. So you can go to the website. It's currently living at UCSF. We are working on conducting research to reveal industry tactics that undermine science, regulations, and health, sunshine these industry influence, and communicate these findings so that policies can be implemented to correct the balance of power to prioritize health and justice. And yeah, I was just going to say, so a lot of the lessons we learned take from the work that's been done in tobacco. And as you can see, there's a lot of success in tobacco. And so we feel that the public is very concerned about toxic chemicals or other types of toxic products, and they are concerned about the role of corporations. So we think that we just need to sort of work on collecting that and identifying the solutions, and we have them in the paper. So thank you very much. And I just want to thank our funders and our team at Stanford.
Thank you so much, Tracy. That was fabulous. And I love that concept of the corporate vector of disease through spreading toxic exposures. And the fact that there's about 1,000 publications that have come from all the work that you've done. We're now going to show...
Not my work, that was tobacco work. We can only aspire to 1,000, which we will achieve someday.
And I also love that they have the tobacco industry and the chemical industry and the telecom industry. They all have the same playbook. All these big industries, big oil, they all have the same playbook. But now you've got your own playbook. So I love that. So we're now going to talk. Thank you so much. That was awesome. We're going to show a video recently done by Kate Tasker. She's a director of the UCSF Industry Documents Library, and she's going to describe how to access these documents, which are really important to research, but also journalists. So thanks so much. All righty, here we go.
Hello, I'm Kate Tasker, director of the UCSF Industry Documents Library. Thank you for the opportunity to share an overview of our work here, and I'm sorry I'm not able to join you live this evening. The Industry Documents Library, or IDL, is a digital portal to millions of previously internal documents obtained from industries that impact public health. It's hosted by the University of California, San Francisco Library, and it's managed by a team of archivists and technologists. IDL began as a digital library of tobacco industry documents, which were publicly released through litigation against cigarette companies, and now includes more than 27 million documents related to the tobacco, opioid, chemical, drug, food, and fossil fuel industries. In general, the Industry Documents Library contains evidence, in the company's own words, of what they knew about the health risks of their products, when they knew that, and the actions and decisions that were then made. We have documents dating back to the 1950s all the way up through today, and we continue to add new and more recent documents regularly. What will you find in the IDL? Well, what would you find inside the file cabinets and hard drives of a large corporation or an employee's saved files? The documents include things like internal memos, letters and emails, presentation slides and conference proceedings, marketing plans, reports and sales data, board meeting minutes, unpublished scientific studies, advertisements, including video and audio recordings, legal transcripts and depositions, and many other materials. About 4 million of the tobacco industry documents originally came from the Master Settlement Agreement, or MSA, which was a historic settlement in 1998 between almost all of the U.S. states and the major tobacco manufacturers. One of the key provisions of the MSA was that all of the documents that had been made public, that had been released through discovery during that litigation, should be made fully available to the public. Other document collections are obtained as a result of litigation against other companies, or from documents that might be released by law firms, collected by journalists who have filed Freedom of Information Act requests, made public through court records. We sometimes collect documents in partnership with other libraries and archives who partner with us to digitize related paper documents in their collections so that they can be shared online. And occasionally we do receive documents from whistleblowers. If you're interested in learning more about how we collect documents, or if you're aware of documents which could be added to the library, please take a look at our website or contact me with questions. We have almost reached our 25th anniversary of the creation of what was originally called the Legacy Tobacco Documents Library. We celebrated our 20th anniversary in 2022. What was then known as the Legacy Tobacco Documents Library was created with funding provided by the American Legacy Foundation, now known as Truth Initiative, and I'd like to acknowledge and thank Truth Initiative for their long support to the library. Public access to such an unprecedented amount of previously internal tobacco industry documents provided significant opportunities for all kinds of research. Researchers have since generated over 1,200 publications, which have significantly advanced knowledge about the industry's impact on health and has helped to reduce smoking and smoking-related diseases worldwide. These researchers include academics, healthcare professionals, journalists, lawyers, policymakers, community advocates, students, and others. The library recognized the increasing research and public interest in how other industries had adopted similar strategies and tactics to tobacco. The IDL then began collecting documents from the drug, chemical, food, fossil fuel, and opioid industries in partnership with colleagues at UCSF, at Johns Hopkins University, and others. Two recent collections related to the chemical industry are the Poison Papers, a set of digitized documents gathered by Carol Van Strum in her battles with Dow, Monsanto, the EPA, the National Forestry Service, and others as she fought to stop the spraying of toxic chemicals in the Pacific Northwest forest where she lived. Another recent collection is the talc litigation documents collected with the support of Dr. Woodruff and the UCSF Program on Reproductive Health and the Environment, which includes more than 3,500 documents released from Johnson & Johnson during lawsuits that alleged that the company knew that its talc products contained asbestos. Other current projects include our work to preserve and make public millions of documents being disclosed through settlements against the e-cigarette manufacturer Juul Labs, in partnership with the university libraries at the University of North Carolina at Chapel Hill. Also, our collaboration with Johns Hopkins University to create the Opioid Industry Documents Archive, which currently holds more than 7 million documents released through opioid litigation. Across all of the collections housed in the Industry Documents Library, we currently have close to 146 million pages and over 27 million documents. New documents are released every month, usually on the last Thursday of the month. More than 1,200 publications have been written which directly cite the documents, the majority of which are peer-reviewed. This research encompasses multiple disciplines such as scientific medical articles, history of smoking and the tobacco industry, evaluation of industry marketing strategies, studies of industry influence on lawmakers and regulatory agencies, and other topics. For example, the Chicago Tribune's award-winning 2012 series, Playing with Fire, investigated toxic flame retardants and the deceptive campaigns that the tobacco and chemical industries waged to promote those chemicals. Another example is the film Merchants of Doubt, directed in 2014 by Robert Kenner and based on the book of the same name by Naomi Oreskes and Eric Conway. These works investigate how industry-funded scientists obscured the truth on issues from tobacco smoke to global warming. At the national level, President Clinton is said to have credited the tobacco documents research summaries published by UCSF professor Dr. Stanton Glantz and colleagues in the 1995 issue of the Journal of the American Medical Association with informing his decision to move forward with a proposal to regulate nicotine as an addictive drug and to regulate cigarettes and smokeless tobacco as drug delivery devices. This ultimately led to the Family Smoking Prevention and Tobacco Control Act, which was ultimately signed in 2009 by President Obama and which gave the FDA the power to regulate the tobacco industry. Possibly the most significant impact of the documents was the creation of the World Health Organization's Framework Convention on Tobacco Control, or FCTC, which was the first global health treaty enacted under the WHO. Based on an expert report by tobacco documents researchers, the framework is a mechanism to prevent the tobacco industry from influencing the development of public health policy related to tobacco control in countries which have signed the treaty. There are many more stories to discover in the library, so hopefully these examples provide a little inspiration for more research and investigation. With so many documents, it can be overwhelming to start searching. I'll share a few pointers today, and our team is also available to provide more in-depth consultations and help if you plan to start working on an industry documents research project. Our first and number one tip is to start by browsing the IDL publications list. This is a detailed list of those 1,200 publications that have already been written on dozens of different topics. You can search the publications list for articles related to your topic of interest and then look closely at the documents that are cited in those papers. These are usually the most significant documents that researchers have found so far and can give you insight into key names, organizations, and other search terms to look for. To get started, you could see this article by Dr. Woodruff and colleagues, which reports on research using chemical industry documents to analyze industry influence on PFAS science. The article is freely available in the Annals of Global Health. You can also just get started by typing in some search terms on our main search box on the home page. It's very helpful, of course, to first think about your topic. What exactly are you searching for? Is it a person or organization? Are you looking for documents about a specific activity like marketing? Or are you interested in annual reports created by a particular company? We recommend that you use search terms that are most likely to match the words in the documents. And so that means thinking about the terms that the industry itself would be using behind the scenes. You can gather keywords from other sources, such as industry websites, trade associations, lobbying groups, or marketing campaigns. Another practice that many of our researchers use is the snowball method. This is when you start with just a simple search and then gather clues from your search results, such as names, phrases, dates, and other keywords to put back into your search to find more specific documents. We have a couple of new resources on our new website that could also help you get started. You can visit our New to the Archive page for links to search tips, frequently asked questions, and other introductory resources. We also have a help section available through the main menu of the website where you'll find quick links to our contact form, that box labeled Ask Us at the top left of the screen, and other guidance. We also offer regular trainings and workshops, including our annual UCSF Tobacco and Other Industry Documents workshop. This workshop is co-hosted with the UCSF Center for Tobacco Control Research and Education. It takes place in the fall, and we usually offer it virtually. For recordings of our past workshops and presentations, you can visit our YouTube channel. You can also email us for research consultations or small group trainings, or sign up for our newsletter to get updates on workshops, events, and new documents that are being added to the collections. To sign up for the newsletter, just visit the news section or blog section of our website. Thank you again so much for the opportunity to share information about the UCSF Industry Documents Library. I would be happy to answer any questions if you'd like to send them to me by email, and I look forward to hearing more about how you may put the documents to work for you.
Great. That was very clear. Very nicely done, Kate. Thank you for doing that. Now we're going to hear from Dr. Nick Chartras, giving us some examples from the Industry Documents Library. Thank you.
Thanks so much, Cindy. I'll just share my screen. And you should be able to see that now.
Yes.
Great.
Perfect.
Okay, there we go. So just before I get started, I've just got a picture up with lots of different logos and brands. Some may be familiar to, and I'm just wondering if you know what they all have in common. And if you do, just pop it in the chat because we're going to discuss it a little bit later. There might be something that seems very obvious, but there may also be something that you're not aware of. So today I'm going to be talking about addressing health harming corporations as the leading global non-communicable disease vector, as Tracy introduced. I'm an associate professor at the University of Sydney, and I've been fortunate enough to be working with Tracy for a number of years on our work, which includes industry documents, research, and as Tracy pointed out, we published a paper in the New England Journal of Medicine only a few weeks ago that used a number of case studies which had been published by colleagues at UCSF, looking at how these different industries had used similar tactics to essentially undermine the science and the regulatory process on their products to continue sale of them. And today I'm going to present a couple of those for you. Importantly, I have no financial conflicts to disclose. Tracy's already touched on, and then Kate did as well in her talk, the fact that there has been this seminal research that's looked at the tobacco industry documents, the important role they played in terms of us understanding how the tobacco industry had hidden the science around the harms of their products for decades. And this was really critical because it allowed us to see in their own words what some of these tactics were. And since that time, as Kate and also Tracy mentioned before, the Industry Documents Library has expanded. It's now containing collections that you can see here on the screen. I've circled two because I'm going to be talking today about a PFAS example, and I'm also going to be talking about an example that includes not only food, but also tobacco industry documents. And these collections are really critical because what we've been doing with our centre since its launch is basically understanding, as I said before, that these tactics aren't unique to one individual industry. They're being shared and implemented by multiple industries. And as you'll hear today, that you'll see that they actually have been transferred from one industry to the next, depending on the products that they're trying to sell. Tracy touched on this framework before. I'm bringing it up again just to help orient you in terms of what the key focus of the two case studies I'm going to be presenting on today are. So the first one's going to be looking at how the chemical industry captured the knowledge around the harms of their PFAS products, so polyfluoroalkyl substances. Most of you will be familiar with those chemicals. They're obviously been in the media a lot over the last several years. And the specific strategy that we're going to be looking at today is how they suppress the science in and around that product. The second example we're going to be looking at today is going to be looking at how the food industry or the tobacco industry shaped the public narrative around their products, and they did that through using sophisticated messaging and advertising campaigns. And so I'm going to talk a bit about that as well. But just to give you some awareness on what I'll be focusing on, this is very helpful to refer back to as the framework. So the first example, this is research that Tracy published. Kate actually touched on it in her talk. It's called The Devil They Knew. And as you can see here, they used the chemical documents within the UCSF Industry Documents Library, and they wanted to understand what the chemical industry knew about the harms of these products before the public did. And so I'm fortunate enough to talk a little bit about that today. Again, just a bit of background. I know most people on this call would understand what these products are, but they started to be developed back in the 1940s. They were best known for developed for their non-stick, stain-proof and fire-proof properties, and they importantly were initially thought to be biologically inert, and they were used globally in lots of different consumer products, and they still are used. There's about 15,000 variants of PFAS chemicals now, but the two main ones that I'll talk about today are PFOA and PFOS chemicals that were best known for Teflon pans and also in Scotchgard, which was PFOS, and also in firefighting foam. So these were the main players in the production of these chemicals. 3M was the main producer of PFOS chemicals. DuPont was the main user and distributor of PFAS chemicals, largely used in, like I said before, Teflon pans. So what did this study do? It took a collection of documents that was actually originally released through legal discovery through a lawsuit filed back in 1998. And these documents had shown that DuPont and 3M had evidence of human health and environmental harms dating back to the 1970s. So the objective was to take these documents and try to, one, establish a timeline of what industry knew versus public knowledge, and secondly, to analyse the strategies that the chemical industry had used to suppress information or protect their harmful products by examining these internal documents. So just to quickly orient you, I think Tracy might have had this on one of her slides, but she skipped over it. The authors of this study had used a framework that was developed by looking across multiple industries in a study back in the late 2000s by Lisa Barrow, who looked across silica, pharmaceutical, tobacco, lead, and also silica industries. And she identified that across those industries, they were using 6 cross-industry strategies to distort the science around their products. So number 1, manipulate the research question, as you can see here. Number 2 was to fund and publish research that supports their industry interests. Number 3 is to suppress unfavorable research, which I said is the focus of today's slides. Number 4 is to distort the public discourse about research, and I'll actually touch on an example of that as well today. Number 5 is to change or set scientific standards to serve corporate interests. And number 6 is then to disseminate favourable research directly to decision makers or to the public. So this is the framework that they were using essentially to look at the documents and see if any of the tactics that they were identifying in these collections were matching to this framework that had been developed over a decade earlier. So this is a timeline of what you can see of publicly available studies that were being published and indexed on PubMed. So they ran a search, and as you can see here, back in the 1950s, and as I mentioned before, these products were being developed and made as early as the 1940s. That for the first about 50 years, there wasn't a lot of publicly available information on these. There weren't many studies being conducted. And again, that's because we thought they were biologically inert. And not until you can see around 2011, when an important review was conducted by a panel which identified PFAS chemicals being linked to multiple health diseases, that there was a proliferation of research. So again, for about 50 years, little was being conducted in this area in terms of identifying or understanding the relationship between these products and potential human health effects. So the second thing they did, like I said, was go through all these documents and scaffold them essentially against these different strategies you can see down the left-hand side. And as you can see, there's lots of different documents that have been identified at different time points throughout this collection. But what I'm going to do is draw your attention to this one to start with, which is back in 1961. And DuPont's chief of toxicology had identified in a study that there was potential health effects. This study, you can see circled in red, it was one of multiple studies that were being conducted internally looking at different health effects across different systems in the body. So on the left-hand side, you can see that there was research being done on systemic toxicity, liver toxicity, reproductive outcomes, testicular adenomas, and also other cancer risk. And the orange boxes is essentially industry research. So studies have been conducted. And again, this isn't exhaustive. It's just an example of the timeline with some of the examples of the internal studies. And then in the blue, you can see is the publicly available studies that were being conducted, or when when the public was starting to realize that there was a potential association with these chemicals and human health harms. So again, in terms of timeline, you can see there's about a 30-year lag between this early study back in 1961 that was being conducted and the public being aware of the potential health effects. So what did this study show, and what did DuPont's toxicology chief state? They said that PFOA had the ability to increase the size of the liver of rats at low doses, and that it was recommended the chemicals be handled with extreme care, and highly toxic when inhaled and moderately toxic when ingested. So again, this was a study that was conducted and reported as early as 1961. But again, it wasn't until decades later until we started becoming aware that these chemicals were potentially harmful to human health. And again, there are multiple examples within these collections, within this study in the collections. So I'm just highlighting one for your benefit, but I highly recommend you looking at the study. The second example I want to take you to is again, around suppressing unfavorable research, but this was based on a pregnancy questionnaire that DuPont had conducted in a section of one of their factories that were using a chemical known as C8. And specifically, it was a pregnancy questionnaire that was given to 8 female pregnant employees. When they conducted this questionnaire, they found out that 2 of 8 women working within this specific area of the factory that was handling C8 gave birth to children with eye and facial defects. So 2 of 8. So what do you think they did? The company did not publish the results or tell the employees about it, but instead they actually removed the female employees from the areas where they were exposed to C8 to make it look like a precautionary measure. What they then did was release with them a joint employee communication, which said, during the period that C8 was used at Washington Works, there is no known evidence our employees have been exposed to C8 levels that pose adverse health effects. So again, they found out that this was had been hazardous or had led to an adverse health effect. Again, 2 of 8 female employees giving birth to children with facial defects. They moved the women out of the facility as a precautionary move, or made it look like a precautionary move. And again, then in terms of what they made publicly known was that they did not have any evidence that these employees had been harmed or potentially harmed by these products. So why is that? Why is this study so important? I think most people obviously on this call know. Most of us have PFAS chemicals in our blood, PFOA and PFOS, but we also have found over the last several decades, or rather last several years, not decades, that multiple authoritative bodies, including the US National Academies of Sciences, Engineering and Medicine, the International Agency for Research on Cancer, which is the leading authoritative body that looks at environmental hazards and their health effects. And importantly, the US Environmental Protection Agency have all come out and said that these are carcinogens. They have developmental effects, immunotoxicity effects, and also reproductive effects. And this is, like I said, only in the last several years where we're getting these definitive evaluations being conducted. And that's almost, again, 60 years since that early study that I showed you. So it's critically important that we understand what these tactics are, which is to conduct internal studies on these products and to try to suppress that information if they're not beneficial or favorable to the industry that's conducting the studies. And we'll get to an important solution at the end. So the second example I'm going to jump to here is looking at tobacco industry owned food companies. And that's what is the link between all these different brands that you can see here. They're all tobacco owned food companies, and many of these were part of Kraft and General Foods and Nabisco, and they were owned in the 1980s by Philip Morris and R.J. Reynolds. So that was my example of what was common. I'm going to quickly touch on 2 studies that good colleague of ours, who's part of the Centre to End Corporate Harm, Laura Schmidt, conducted. And she's looked at basically how these corporations, tobacco-owned companies, rather transferred racial and ethnic marketing from tobacco into food, but also how they got involved in children's sugary drinks. So their objective, again, similar to the PFAS example, was to go and take these industry documents and look at these documents to understand why the tobacco companies would want to enter into the food market. And what they did was take this collection of documents dating back to 1962 up to 2008 and understand basically why the R.J. Reynolds and Philip Morris executives moved into the food and beverage market. They searched through about 40,000 documents. And this is one of the key things that they found. They found that both R.J. Reynolds and Philip Morris leveraged product development technologies and marketing infrastructure, which you can see in those images on the right, that were developed to sell cigarettes to essentially benefit their ultra-processed food brands. And one of the particularly important strategies that they used was something known as the Synergies Initiative, which was launched by Philip Morris in the mid-1980s. That was really focused on leveraging product formulation technology. So basically taking research on artificial flavoring additives, but also marketing infrastructure. So integrated co-branding schemes. And they implemented it across its tobacco, food, but also alcohol subsidiaries. So not only were they using it across food, but they also were aiming to use it also in alcohol. This is a really important example. So what you can see here, many of you probably know what this is Kool-Aid. And initially, Philip Morris had, when it acquired the Kool-Aid brand, you can see there's a very narrow set of products. And what they did, they then went and applied their marketing strategy focused on targeting specific marketing segments to proliferate dozens of the extensions of Kool-Aid and introduced at least 36 different flavors, which you can see there on the right-hand side. And these include multiple brands that are familiar or mascots that are familiar to many children. It was very much designed to get children engaged in consuming these products, and it was incredibly successful in driving up sales. What they also did was, through its Synergies initiative, Philip Morris translated its minority targeted marketing strategies for cigarettes to marketing ultra-processed food brands in Black and Hispanic communities. And this included financial deals with ethnic media and civil society organizations, along with event and sports sponsorship deals used to ingratiate these communities. And so what you can see here is a diagram that was actually found in the archive illustrating Kraft's minority marketing strategy. And by 1999, Kraft Foods was one of the top food manufacturers targeting ethnic minorities with an annual ethnic marketing budget of around $24 million a year. Also importantly, what's the legacy effect? So these companies are sold out, these tobacco companies sold out of the food companies in the early 2000s. But we have this, what they did was also intentionally develop what we call hyperpalatable food products, where they changed the ratios of sodium, fat, and carbohydrate, and also sugar. And what we've learned is that those products that were those food brands that were owned by tobacco-owned food companies were more likely to be hyper-palatable during that time period that they owned them. And now we know that there essentially a lot of other food corporations have used that knowledge and that technology to reformulate their products as well. And so we've seen this lasting legacy of the tobacco-owned food companies and what it's done to our food system. And that's led to about 60% of all our foods now in the US food system and also in our diets being ultra-processed foods. Just finally, Tracy touched on our study and what our solutions are. This is probably the two main ones based on the examples I gave today. We want to ensure we hold corporations to the same standards of data sharing and open science adopted by independent scientists. That means that basically when corporations, if they want to conduct an internal study, that they make it publicly available, the study protocol. It goes into a trial registry. We're able to see all their data and we can see all the studies that are conducted. Finally, number 4, again, ensuring that corporations that make these products are part of the policy-making process, and so that they're removed when we're thinking about bringing in advertising bans or when we're thinking about labelling for things like ultra-processed foods. And the Framework Convention on Tobacco Control, Article 5.3, is certainly a blueprint that we should be modelling that off. So with that said, I'm going to pause and stop sharing my screen and looking forward to answering any questions. Thanks so much.